Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah. Today we are going to talk about tonsillitis. So, what is tonsillitis? Tonsillitis is the inflammation of the tonsils. Then, question raises, what is tonsil? So, tonsil are in fact a accumulation of all the defense cells are known as lymphocytes, and it's a immune tissue which try to protect the body from different infections and exterior and external elements. So what happens is that we are exposed to the different viruses and other elements all the time, and they try to attack the body, and body's defense system try to protect the body. So anything which is in your mouth can try to go through to your airway system or to your uh, stomach, which can be hurting. So tonsil, they try to screen the area to make sure that the person is safe. So tonsillitis usually happens in the very early age. That's the time when body is building its defenses. So tonsils are really increase in size due to exposure of different kind of elements or infections, and that's the reason it's more common in the babies or even in the toddlers and the children. And as you grow older, the tonsillitis infection of tonsils goes down. So there are two types of tonsillitis. One is acute tonsillitis, and other is the chronic tonsillitis. So in acute, it's usually some viruses or bacteria which cause the infection, cause pain, and it resolves within 1 to 2 weeks. But in chronic cases, it comes back again and again. It can be recurrent, or it can continue to have infection for a long time. So what are the signs and symptoms? Usually these kids have high fever, they have throat pain, they can have runny nose, and they will be eating low and can have fever, and they are really grumpy most of the time. So what is the treatment? Treatment is that we try to hydrate the child, because these kids tend to drink less and eat less. So we might want to make sure the child is nourished, and we try to give them the soft and hard diet so that they can swallow easily. And sometimes we have to give the treatment in forms of antibiotics. There are different bacteria could be involved, but many times it can be due to viruses. So acute tonsillitis, what can be the problems? One of the most important problem could be obstructive sleep apnea, because when the tonsils are enlarged, they don't let the oxygen or air flow into the lungs, and that can cause problem with the breathing and cause problem with the sleeping, and that's known as sleep apnea secondary to tonsillitis. So what other problems it can cause? The infection can be transmitted from tonsils to peritonsillar area and other neighboring organs. So that can be very troubling sometimes. Another important complication is halitosis. So halitosis is where the breathing is bad. So you can have bad smell from the mouth all the time, which can be very discouraging. Sometimes there can be autoimmune problems too, like there's infection, so there is cross-reactivity, and it can lead to nephritis sometimes, and even endocarditis, which is immune mediated. So what are the possible complications? One of the more important is the child is sick all the time. Child can have start missing going to school, and it can have some problem with the growth of the child. And as I discussed earlier, it can go with autoimmune infections of the kidneys, or it can cause an autoimmune infection to the heart. But one of the very, very important thing we should consider is the sleep apnea, that there is obstructive apnea due to enlarged tonsils. So we have to be very careful. Suppose we don't take care of it properly, and there's hypoxia all the time continuously, which can lead to the hypertension in the pulmonary system. So that's a very bad outcome. That's the time when we have to make sure that child's tonsils are operated or removed so that child can grow out. Many of these kids, when they're sick chronically, they have problem with their growth and going to school, so they can be delayed in their development with passage of time. So make sure to come to your doctor if it happens recurrently, and then they have to decide whether they need to remove the tonsils or not. Thank you very much.